Module 9 UHS Modular Integrated Undergraduate Curriculum Physiology Sheikh Zayed Medical College Physiology Department. Dr. Sheen, CEO and founder, Medical Superfast Simplified Physiology Video Lecture Notes. Guyton and Hall 14 Edition Lecture. Number 22 CH 38 A500. Learning Objectives. Enlist the respiratory and non respiratory functions of lung. Respiratory functions of the lungs. Exchange of gases between the atmosphere and the blood. The body brings in O2 for distribution to the tissues and eliminates CO2. Homeostatic regulation of body pH. The lungs can alter body pH by selectively retaining or excreting CO2. Protection from inhaled pathogens and irritating substances. Humidification. Adding moisture to inhaled air. Vocalization. Air moving across the vocal cords creates vibrations used for speech, singing, and other forms of communication. Warming/cooling. Regulating air temperature, 37°C, so that core body temperature does not change and alveoli are not damaged by cold air. Reservoir for blood. Storing blood during periods of increased demand. Compliance. Lungs' ability to expand. Elastic recoil. Lungs' ability to return to original shape. Dysfunction in these respiratory processes can lead to various lung diseases and disorders. Non respiratory functions of lung. The respiratory system. It is a route for water loss and heat elimination. Inspired, inhaled, atmospheric. Air is humidified and warmed by the respiratory airways before it is expired. Moistening of inspired air is essential to prevent the alveolar linings from drying out. O2 and CO2 cannot diffuse through dry membranes. The pulmonary capillary bed acts as a blood filter, preventing particles like small clots, detached cells or air bubbles from reaching the systemic circulation, where they may block capillary blood flow within essential organs such as the brain. The airways remove airborne particles by phagocytosis or mucociliary action aided by coughing. Ventilation of the airways contributes to heat loss and water loss. The pulmonary vessels are an important reservoir for blood. The larynx is used for the production of sound, phonation, production of sound by vibrating the vocal cords. The nose, a part of the respiratory system, is the organ of smell, smelling by detecting chemicals in the air. Olfaction, route of drug administration. Synthesis of surfactant helps maintain blood pH by removing excess hydrogen ions. Alveolar macrophages and other immune cells protect against infections. The lung has many metabolic functions such as a conversion of angiotensin 1 to angiotensin 2, b. synthesis and removal of bradykinin and certain prostaglandins, c. storage and release of serotonin and histamine, d. inactivation of noradrenaline and adrenaline, e. synthesis of peptide-like substance P and opiates, f. secretion of heparin by mast cells, and gram. secretion of immunoglobulins in the bronchial mucus.